so this is Sakshi Sharma and most welcome to my channel Fact Madam. So in this video, I am going to tell you everything about the antigen rapid test. Antigen rapid test, whose full form is antigen detecting rapid diagnostic test, or in short, we can conclude it into AGRDT. So this video is going to be the third part of antigen rapid testing and in English obviously. So antigen rapid testing is a new technique for COVID-19 detection apart from RT-PCR test. RT-PCR test, whose full form is reverse transcriptase polymerase chain reaction. So in this video I am going to tell you that how antigen rapid testing is more beneficial than RT-PCR test. So this video is the third part of antigen rapid testing, in which I am going to tell you that antigen rapid test versus RT-PCR test for COVID-19 and what you need to know. So this study is given by Palto on 29th of July in 2021. So as he says, while RT-PCR test is a current gold standard to confirm SARS-CoV-2 infection, antigen rapid test ART allows quick detection for COVID-19 and it allows fast detection for SARS-CoV-2 and also allows quick detection for SARS-CoV-2 and thus fast triaging of infected patients requiring isolation at the population level. According to studies presented at ECCMID 2021, RT-PCR does not have a fast enough turnaround time and places high demands on personnel, equipments and consumables. Therefore, its use for the purpose of population-wide testing is limited, as it was said by researchers. On the other hand, antigen-based testing is inexpensive, rapid and easy to use. As they pointed out, antigen rapid testing can provide results in approximately 15 minutes, which is faster and are lower cost than RT-PCR test. Antigen rapid test also presents a point of care testing without the needs of specialized equipments or personnel, which according to the researchers is useful in situations with limited access to molecular methods or no staff expertise. Now I am going to tell you population screening. Antigen rapid test as a complement to RT-PCR test. As early and reliable detection of new COVID-19 cases is crucial to containing the spread of the virus. Researchers compared the utility of antigen rapid testing versus RT-PCR test in the context of population-wide screening involving 11,142 individuals ranging from age 7 months to 98 years who attended a hospital collection site for preventive testing in Czech Republic. A total of 13,130 nasopharyngeal swabs samples were subjected to the pan-bio COVID-19 antigen rapid test on site. Those who tested negative on the antigen rapid test but reported symptoms of COVID-19 such as fever, loss of smell and taste, sneezing, nausea or vomiting had additional samples collected for further testing. With RT-PCR, overall 679 people were tested positive on the antigen rapid test, of which 401 people showed the symptoms of COVID-19, representing the true positive population of antigen rapid test, and the remaining were asymptomatic. Among the 12,451 people who tested negative on the antigen rapid test, 1,423 people reported symptoms and thus subjected to further testing by RT-PCR. A total of 259 turned out to be positive based on the RT-PCR test, representing the false negative population. Combining these data yield a sensitivity rate of 60.8% for antigen testing in symptomatic persons. To minimize the results of false negative results, strategies based on the combinations of antigen and PCR testing or repeated antigen testing with high enough frequency are advised, and it was said by the researchers. So now I am going to tell you about rapid triaging. Despite a lower sensitivity to detect infection compared with RT-PCR, antigen rapid test can be important tool for screening because of quick time. Lower costs and resource need, high specificity and high positive predictive value, which is known as PPV, in setting of high protest probability. That was coined by another group of researchers led by Dr. Karalampos Zaras from Hippocratean Hospital, Thessaloniki, situated in Greece. The researchers compared the Panbio antigen rapid test against RT-PCR test in 195 symptomatic patients who was presented at the emergency department in the hospital. It is important that the fastest time for screening to reporting results can accelerate the isolation of infectious individuals and is especially important in the areas of high prevalence, and it was highlighted by Zaras and colleagues. A total of 113 samples were turned around to be positive based on RT-PCR testing, of which 57 samples were also initially detected as a positive by the antigen rapid testing. This yields a sensitivity rate of 50.4%. As all the 57 samples were tested positive on the antigen rapid test were validated to also be true positive by RT-PCR testing. This corresponds to a PPV of 100%. So specificity was 100%. Another 56 samples which were initially tested as negative on antigen rapid test eventually turned out to be positive on the RT-PCR testing, that is false negative on antigen rapid test. RT-PCR test should be performed to confirm a negative antigen test results, and it was said by Zaras and co-authors. Of note, the 57 true positive samples showed RT-PCR mean cycle threshold CT value that was lower than the antigen rapid test false negative samples, ranging from 16.8 to 17.1 versus 26.5 to 26.9 for S, F and ORF1AB gene testing. This indicates that ART performed better for samples with high viral load, and that was reflected by lower CT values, for instance during the acute phase of COVID-19. So what was the high impact within first week of illness? When tested within 7 days of symptoms onset, a period when patients are likely to have a high viral load, ART in general can reach a high sensitivity rate that was greater than 90 according to Dr. Claudia Tenkinger of Heidelberg University of Hospitals, that was situated in Heidelberg in Germany, who spoke during a session on ART of COVID-19. As patients with a high viral load are more infectious, that is transmission relevant, than those with a low viral load, ART presents a valuable tool that allows for large screening program to contain transmission. The key thing about the ART is that it is fast and you don't have to wait for many days from PCR to find out that who has been infected and needs to isolate. And it was said by Deckinger. However, tested at any point of infection, the sensitivity of antigen rapid testing in general is about 40 to 50%, she pointed out. Hence, this cannot be a rule-out test. And this is especially critical for asymptomatic cases because we don't know that when the exposure happened or when the onset of infection was. So we might be testing at any time at any point of the infection beyond the first week. Explaining how ART supports public health interventions, overall, Deckinger said testing is not sufficient on its own and should be used in the combination with other containments and mitigation measures to control the spread of the disease. ART is useful for increasing the capacity of the testing and particularly to identify those that are transmission relevant and to inform population-wide distancing measures, as she explained. So what we have to do with antigen rapid testing results? So individuals who have a positive results from ART should get a confirmatory PCR test immediately and isolate themselves until they tested negative on PCR. And it was according to the guidance from Singapore Health Ministry. Meanwhile, those with negative ART should continue to be vigilant and observe the prevailing precautionary measures. So guys, thank you for watching this video. I hope that you like this content on antigen rapid testing, and so please do subscribe to this channel. Please do like, comment and share this video to everyone. So thank you guys.